why is it important to talk about Black maternal health?
Well, Tracy, it's important to talk about maternal health in general. We know that of all the industrialized countries, the United States unfortunately leads with regard to maternal deaths for all people, not just Black women. And the reason that it's important to talk about health disparities in general, though, is that we know that Black women, as well as Native American and Alaskan Indian women, have the highest risk of maternal death.
So let's say you're a couple and you're planning your pregnancy. You want to expand your family or start a family. When should that couple seek advice on fertility issues and concerns from their doctor?
So if it's a young couple, then if they've been trying to get pregnant for a year and have been unsuccessful, then that would be the appropriate time to have that discussion with their doctor. If they're older, then over 35, or specifically if the woman in the relationship is over 35, then that discussion really needs to happen at about the 6-month mark.
Is there anything that you, from your clinical expertise, could recommend to couples that are experiencing a pregnancy loss?
Most people don't know how common early miscarriage is. And when I say early, I'm including prior to even being aware of the positive urine pregnancy test. So it can be as high as 20%. Right. The good news is that once there's a heartbeat established, then that risk falls below 5%. So the first thing I tell nervous people when they come in is that once we've had that ultrasound and we confirm that the pregnancy is in the correct place, which is the uterus, and that there's a heartbeat, their risk of miscarriage really falls significantly.
What exactly is gestational diabetes, and how do women know that they have it?
The simplest answer is that gestational diabetes is the development or the knowledge that you have diabetes during the time that you're pregnant. That's the simple answer. The more complicated answer is that we can discover that someone has diabetes at any point in their pregnancy, but especially if we find it very early on. It's not necessarily that the pregnancy caused the diabetes, but that the person had undiagnosed diabetes going into the pregnancy. And so the normal time for us to check for diabetes is about 26 to 28 weeks. However, if a woman has risk factors like obesity, like a history of diabetes in their family, like pre-diabetes, then we test that person much earlier. And if we find that that exists, then we treat them as if they've really had type 2 diabetes.
What is preeclampsia and how do you get it?
So preeclampsia is specific to pregnancy, and it essentially means that you have high blood pressure in pregnancy. The problem with preeclampsia is that we don't know why one pregnant person gets it and why another person doesn't. But we do know that it has to do with blood vessels and stiffness of the blood vessels and them being leaky, et cetera. But we do know that there are people who have increased risk for developing preeclampsia during their pregnancy. One of the most common risks is if that person's been pregnant before and had preeclampsia in the last pregnancy or in any pregnancy before this one that we're talking about. Another risk factor is if that person has chronic hypertension, meaning that they come into the pregnancy with a blood pressure problem and can develop preeclampsia on top of the blood pressure problem.
So it sounds like it's very important to be mindful and monitoring your blood pressure throughout your pregnancy and checking for those signs and symptoms to share with your provider. What resources are available for individuals struggling with postpartum depression?
Well, one of the first resources is the person's doctor or their midwife,
Right.
the person who's been taking care of them through the pregnancy. And so it's really important to feel comfortable talking to that caregiver about the symptoms that you have and being honest about those and not feeling as if there's some kind of stigma to admitting that you're having some trouble and that you need help.